Hi, everybody. We want to welcome you in on this Tuesday to Coronavirus Inside the Arizona Numbers, where we take a closer look at the data and the numbers coming out of Arizona so that you can make the best choices for your family and your life. A lot of schools making tough decisions this week and last. We'll preview some of those. I know you all have questions about that. I'm getting a lot of questions about whether the state is going to shut down again. We'll talk about all of this coming up in this quick hour with you. It does go by so fast. And Garrett, I heard you guys were not here yesterday, so I'll give you some time to update us kind of how yesterday looked. It was a typical Monday, now typical Monday. We're seeing higher numbers, of course. Yeah. And then for this Tuesday, almost 3,000 cases reported in today.
Correct.
So we're kind of hitting a trend in that, and it'll be interesting to see if it levels out. But I'll let you walk us through where we always start with the AZDHS site.
Yes. So yesterday, because we didn't go over it yesterday, we had 1,476 cases, and that was off of, let's see, how many tests? I have to go back to that. Sorry, that was off of 13,000 tests. Typical Monday. This is what we see. We usually see lower numbers on Monday. And then today, as you can see right here, we have at 2,984 cases added today off of 16,000 tests. This is a higher number, and this is actually, believe it or not, our average, our 7-day average, because of yesterday, has come down a little bit, and our week over week is actually flat from yesterday's report. So it's really going to see over the next couple of days to see if it climbs. We had some really high numbers last week as well. So while we're looking at this 2,900, we had higher numbers last week. So it's interesting. I believe we're probably still climbing, but we may also be on the verge of a leveling off. So
yeah, last week was sort of an anomaly in that we had a holiday in the middle of the week, and
correct.
So that sort of threw off the numbers as they came in from the state, or had us have high days then lower days, and kind of made things just a little bit different. That's why next week will be just as interesting with Thanksgiving and how those reports come in.
And that's exactly right. Because of that holiday on Wednesday, it could be throwing off the numbers. So while the numbers sort of indicate that we might be showing a leveling off, that might be, like you say, sort of a false positive or a false flag, because of that Wednesday holiday kind of messed up last week's numbers. But nevertheless, that is where we are today. And another thing that we have to talk about is the percent positivity for today. If you do the simple Johns Hopkins calculation, we're at an 18%. However, when you actually look at what the true positives are for the day, it's still quite high today. Our true positives, let me just make sure I have this, it was at 15%. And then every single county today, with the exception of Greenlee, that did not report any tests, were over double digits in their percent positivity, something I have not seen yet. This is the first time that I've seen that happen. Now, that being said, I was not tracking this positivity rate back at the very height of the pandemic in early June, July. So that it may have gotten to the point where all counties were at double digits back then too, but I simply wasn't tracking it. We now have the ability to track this metric because of new data released by the AZDHS. And like I said, today, double digits in every county.
We not only saw those high double digits, but also a high number of tests coming back. Now, part of this is we have the ability to test more now. At the height of the pandemic in July, there were some struggles with getting testing done, whether it was the lines that were happening there, so not enough testing sites, or some of the agent to test. All of those things were sort of delaying the numbers, but this is giving us a truer sense. So far, though, the entire pandemic, 2.3 million tests back here in Arizona.
2.3 million tests. We're at about 10.1% aggregated percent positivity. And what's interesting about that is, if you recall from yesterday, Maricopa County released its Sero survey. That gave us sort of the how many people they believe, or what our herd immunity in Arizona is at this moment, or in Maricopa County. And they did say our herd immunity is around 10%. So it's interesting that right now that those numbers are correlating. I don't know if that's a causation. I'm just saying that it's very interesting to see those numbers sort of matching together right now. I'll show you really quick before we move on what you're talking about. This is the percent. This is the tests that we've done, and this is the reported tests, not the epi curve. And as you can see, this is what you're talking about. If you look at these numbers now, you look at this average, you can see our average number of tests that we're doing on reporting on a daily basis are now higher than they were in the very peak of the pandemic back in late June, early July. So we are now at this point testing more people on a daily basis than we did at the very, very beginning of this thing.
And I just want to remind everybody, I've gotten so many questions personally about where to go get a test. So this should be something everybody knows how to locate this information. Go to the AZDHS site, and you can scroll about halfway down, and you'll be able to find all of the testing sites across Arizona, and also the saliva-based testing sites as well. So if you're not interested in the deeper nasal poke there, they also are able to get you a saliva test. Price should not be a prohibiting factor. Those tests are free, and you will be able to find how to get a free test right there. So I'm also getting spam email on getting a free test, but you can do that through a trusted site like AZDHS. Okay, so one of the things everybody's talking about today, Garrett, is the White House, and we got some information from ABC News that they were reporting from the White House task force that they're saying 100% of all counties here in Arizona have moderate or high levels of community transmission. And the White House claims that our current mitigation strategies, our current mitigation efforts, which some say are not enough, the White House agrees. They say that they're inadequate and that they must be increased for us to be able to flatten the curve to make sure our hospitals don't get slammed. We're seeing hospitals across the country that are filling up. We're seeing ICUs across the country that are filling up. And this is the exact information that we got from the White House task force on this.
Yeah, now obviously I'm not going to read this word for word. It's really hard to read anyway. But this is basically saying exactly what you talked about. It's talking about how there is significant community spread in Arizona, and that it is in the red. The state is in the red. Most of the counties are in the red, and that they are suggesting stronger mitigation efforts in the state to curb COVID-19 here.
And one of the interesting things is down here in the bottom half of the report really gives us some numbers that we can dive into as well, as you're sort of revealing that page right there, Garrett. That gives us a little more information when they're referring to the national profiles in the back of the packet. They're saying there's now aggressive, unrelenting, expanding, broad community spread all across the country, reaching most counties without any evidence of improvement, but rather further deterioration, and that's reflected in the numbers here.
Yes, absolutely. And I see someone asking where we can get this to read. I don't know if this is on our website. This is something that was sent to me. This is from ABC News.
Yeah, this is just coming out, and I know some of our reporters are working on this information right now. So you all are getting an early snapshot, if you will, at it. We'll have more reporting on it and through our evening newscasts as well. But what do you see from these charts, Garrett?
So they're basically using a very similar grid pattern, a gradient coloring pattern that we have in the state. You can see right here that the viral PCR test positivity rate is 9.3%, which is a 1.8% jump from the week prior. This is pretty much correct. Although this week already, this is the report from November 15th, but the data is probably a little older, simply because we're now past 10% at this point in the state. So we're actually already above that. So if you looked at this again, we would be more matching this number than 9.3. So this is basically showing all of the data that they're using to make these determinations. This 38% weekly increase. It is saying that our testing is increasing. Which is, you know, the one of the good sort of silver linings of this report, that the testing is increasing. The COVID-19 deaths are going down still. It's less than 15. It's minus 15% for the week. And then here's some more information. This is our reported. You see this pretty much every day if you watch. In fact, it even looks like my chart. Because it uses the same coloring scheme as my chart. But this chart, if you watch this broadcast, you know this chart. This is our daily reported COVID-19 numbers. This is our testing, our positivity rate. You can see how the testing is increased, and so is our rate at this point. It's now going above 10%. This is a county graph of all of our counties. Now, this is a little hard for Arizona because Arizona is in many ways a unique county, a unique state, because we have one county that has just a mass of the population. And so when you look at this and it's cumulative, it's not per capita, obviously Maricopa County is going to be much, much higher than everyone else. And then this is a very interesting, I found this to be one of the more interesting graphs, because this is not something that's truly readily available in this format on our reporting site. And this is this diamond for every single week, it's showing the percent of hospitals that are reporting data. And you can see there was an increase of hospitals reporting data over here from basically late September to early October. Our hospitals began to report it almost to 100%. And you can see that obviously there's been a pretty massive rise in hospitalizations since then, from about, it looks like 1,700 to just under 3,000 for all COVID-19 hospitalizations in Arizona in that time frame. If you read this report, it's the coloring is a little difficult to read here, but it's trying to break it down by age groups and show you what, there's an unknown at the top, and then it sort of goes down by age groups and tries to, figure out what the age categories of people who are hospitalized. And you can see, obviously, the younger age group demographics, under 18 to 39, while they make up the majority of cases, they make up an extremely small number of hospitalizations. Almost all the hospitalizations are in the older demographic.
So it reflects exactly what we're seeing on sites like COVID tracking, where they're saying the amount of people ever hospitalized here in Arizona for COVID-19 is about 23,000, and then our current number of Arizonans hospitalized at just under 1,600. Is that sort of what you're seeing reflected there?
That's sort of what this is saying, is that it's reflecting that. So, and then this is an interesting, this is a very easily digestible table, which I like. This is showing basically our census metro areas, the statistical areas, and then also the counties, and what localities they believe are in the red zones, and which are in the orange and the yellow. And you can see, as far as metro areas, they find that Tucson, Yuma, Lake Havasu, Kingman, Sierra Vista, Douglas, Safford, Payson, and Nogales are all considered red zone right now. And those counties are Pima, Yuma, Mojave, Cochise, Graham, Gila, Santa Cruz, and Greenlee. So that's really a big mix of a lot. I mean, there's some northern counties, there's some southern counties there. I think all of the southern counties are in there, and then some central counties. And then you come to the localities in orange, and it's basically the Phoenix area, Flagstaff, and Show Low, and then Prescott. So mostly northern Arizona and central Arizona in the orange, and that's again in the counties Maricopa, Pinal, Coconino, Navajo, Yavapai, and Apache. So basically central northern Arizona. And then the only county in the yellow zone is La Paz, which also has a very low population, second lowest in Arizona aside from Greenlee County.
So is this proportion of patients to beds? Is this because they don't have enough hospital space, or wouldn't have enough hospital space if this continues to increase? Or does this look like a case chart that they're giving here? Does it give any indicators on the bottom of those alerts and concerns in those three areas?
No, this looks like a case chart.
Yeah.
So this is not tied to counties. This is basically cases, the changes from week to week, and where they're putting things in the red. So you can see this +3 means that they moved, 3 of these were moved from orange to red over the week. 4 counties were moved from orange to red, and 2 counties were moved from yellow to orange.
Yeah.
And this seems to be just like a week by week case number, if you will, of these areas and what's happening from week to week.
Well, we can see it's shifting pretty quickly.
It's shifting up very quickly. Yeah, if we're moving 4 counties and 3 localities into the red over 1 week, that definitely means it's shifting very quickly.
Yeah, when we only have 15 counties here in Arizona. So all right, so daily cases?
Yeah, this is something I don't get to show a lot because it's a little hard to show. Let me see if I can bring this up a little bit, make it a little easier to see, and without it being that terrible to navigate. Okay, that's a little better. So this is our top 12 counties based on the number of new cases in the last 3 weeks. You can see Maricopa County, of course, reflects the line that we all are pretty much, we know, because Maricopa County is such a large county here. Pima County, massive spike during the U of A antigen testing. And then it went down, and then now it's kind of following the same trajectory as Maricopa County. Pinal County, similar, following a similar trajectory, going upwards in that. And then Yuma, same thing. Coconino County sort of had a big spike right here with NAU, and then dropped off, and then started going back up again. Navajo really was almost at, as you can see, Navajo almost went to 0, and then just really started to pick up. And so all of these are following a pattern. Yavapai County, this one's very interesting. You can see, some of Yavapai's most reported days have come in the last couple weeks. And same thing with Coconino County. You've got these counties that are now experiencing their first peak. In Maricopa County, it was the other way around. Still, we haven't experienced a second we're still lower than our first peak here, but you've got some counties where their peaks are now just starting. Gila County, Graham County, Apache County, not quite, but it's getting there. So there's these areas in which this is starting to happen where they're just getting to their first peak.
Well, it tells an interesting story because so often when we refer to the situation in Arizona outside of the Navajo Nation, it seems to be sort of the same story of a really bad July. And what this is telling when we break it out county by county is that some cases or some counties, this is their worst part of this pandemic. So worth noting in all of this and how they work to fight this.
Yavapai County is a great example. I mean, even during the worst of the pandemic, Yavapai was very well under control during that entire time. They did go up, as you can see, but it pretty much leveled off. They're now starting basically a peak right now in that county, and that's happening in several other counties. That during the first I don't want to call it the first wave, but the first sort of increase when we had that first peak. These counties were not being, Graham County, Yavapai County, Gila County, all of these were fairly level during the July months, and now they're really starting to surge.
Yeah.
Quite interesting. What this is basically a map of the counties showing the new cases per 100K. You can see this is what we were talking about, how 500 or more per 100K in southern Arizona, the Navajo Nation area, as well as eastern Arizona, with Graham County just really, really spiking. In fact, that's the one that's in 500. All of these others are 200 to 499. And then in Maricopa and the rest of central and western Arizona, it's closer to 100 to 200 cases. The percent positivity rate, again, with Graham being much higher than everybody else, and everybody else is being sort of in the 8 to 12 or 8 to 20 range, with most of Arizona being the 8 to 10, and then southern Arizona being in the 10 to 19%. And then let's see, new cases the month before. So this is interesting. It's showing what it looked like the month before. You can see there was still some movement of the virus in the Navajo Nation, but aside from that, and some in central Arizona, right here in these two counties, Gila and Graham, but basically we were starting to go down to under 50 cases in most of the rest of the state. And you can see the percent positivity was also going down. So we're truly experiencing a decline at this time. And then it just started picking up again. And that is this report. So that is the last page of this report.
So this is, for anyone that's just joining us a little bit later, this, of course, coming from the White House Task Force through ABC News. We are lucky enough to have a peek at this. It gives us some insight into how the governors are being briefed on this as well. We have not heard from our governor. We have repeatedly asked for a response from him on this and what the plans are moving forward. We know so many of you are thinking about schools. You're thinking about businesses that you own or businesses that you love, that you're concerned about being able to stay in business. And we have not heard from the governor on this. So as soon as we do, we will bring that to you. And I just want to stress to you that we have asked repeatedly to hear from him on this, but we have had no response. So that's how things look as far as how the White House is viewing this. Again, for those of you just joining, they're saying that the current mitigation efforts here in Arizona are inadequate and that we have to increase them in order to flatten the curve to make sure that our hospitals are not going to be slammed in all of this in the coming weeks. I know if anyone gets this, they want to know that there is proper care out there available to them, and that, some of the pictures that we saw from over the summer of hospital beds set up in the hallway and God forbid morgues outside of the county offices there, that they don't want to see that again. And so that is the idea here, to bring forth mitigation strategies so that we don't have an awful situation like we saw earlier this summer. I know so many of you have questions, and I want to get to them. Yes, we'll keep asking the governor for any kind of information on this. And when we hear about him having anything besides a video message, that's all we've seen, we'll provide that as we have, but we would love to hear a little bit more about his plans, because again, we know so many of you have your livelihoods and your kids' school tied to all of this. So to update everybody, the updates from the county come on Wednesday, but then the updates on the school dashboard comes on Thursday. It's been bumped up a little bit earlier in the morning. I believe it comes out at 9 a.m. now. So on Thursday, we'll be going over all of that. I've had so many school districts or so many parents, I should say, from different school districts, Garrett, asking if they're going to shut down on Thursday. We'll know more by Thursday. So that's when we'll pass that along to all of you. When we're looking at these numbers, let's talk about the hospitalization numbers. Are they increasing here in Arizona at this point? I know that you're saying of the 280,000 cases that we have had through this pandemic in Arizona, we have seen between 11 and 8% of them showing up in our hospitals. And as we talked about earlier, 23,000 Arizonans have gone to the hospital with COVID and had to be taken in and receive care there. So it's gotten that bad for them. As I mentioned a little bit earlier, 1,557 are currently in the hospital. Where do those numbers then, Garrett, sort of fall with how much space we have at this current point?
So this is where we are right now. Using again AZDHS data right now, we are at about ICU. We're at about 23% of the ICU patients are from COVID-19. About 64% of COVID-19 patients are from 64% of ICU patients are not COVID-19. And that gives us a headroom of about 13%. As you can see, the hospitals have been trying to keep this in the 80s for quite some time. They did get to achieve a low on 9/29, where they had a headroom of about 25%, so only 75%. Now they're up to about 87% of the hospital space is being occupied. But let's go to inpatient. Similar situation here with inpatient. You can see about 19% of inpatient is from COVID-19. About 68% is non-COVID-19 with a headroom of about 13%. And you can see that, again, they've done their best to keep this headroom about where it is. So even from early October, so about a month and a half ago, we had about the same amount of headroom that we have now. So they are doing hospital and patient management right now. We are kind of in that same, even though our COVID-19 cases are increasing, they are sort of maintaining that number, at this level. They will continue to do that. They're simply just going to start, it'll start shifting more to COVID-19 patients and away from other patients. That's just what's going to happen. Well, it might happen if things continue. I don't want to say that I know.
Well, and Garrett, it always has a chilling effect too, because people who are getting elective surgeries, we had that situation in my family. There was an elective surgery that was suggested in March, and we thought, you know what, let's hold it off till September, so we can at least get in that little lull of these hospitals being maxed out, and really the care needing to go to these people in these emergency situations instead of somebody who can hold off on a surgery for a matter of months. And Jackie's writing, Katie and Garrett, thank you for all the information, helping us to make informed decisions about Christmas. So let's talk about the holidays, everybody. What are your plans now? Are you doing holidays on Zoom? Are you not changing your plans? Are you, I've heard of a lot of people testing the couple of days before quarantining and then getting together. How are you sort of adjusting Thanksgiving? If you're like me, when are you going to celebrate Thanksgiving? In May? That's what we're going to be doing. We're just going to postpone it and pick it up when it feels better for us. Maybe in the summer. Maybe we'll have a picnic outside in the summer to celebrate all that we are thankful for. Because if this has taught us anything, it's to be thankful for every darn thing out there. Even homework, even going to school, even all that boring stuff that we used to say, I don't want to get up at 7 a.m. to go to school. Now our kids are grateful to do it, right? Margaret's writing, cooking and just the household only. So we're hearing that from a lot of you. Thanks for sharing, Margaret. Jackie's saying push plans back to February. So they're going to wait to do something. Learning to live with it. We're doing holidays with a small group of loved ones who have also quarantined, Katie Smith writes. So thanks to all of you for sharing. Keep them coming. Yes. Kimberly writes, if elective surgeries are held off for too long, they do become urgent. Absolutely. I'm just so grateful for the healthcare workers who were still working when we had a surgery that we could push off just a bit. Debbie's asking, are schools closing? Debbie, I want to point you to the best place to find that information. The short answer is yes. Some of them closed last Thursday when the very latest numbers came out. You can find that information for your kids, for your grandkids, for the schools in your neighborhood at abc15 .com/schools. There, I don't know if the dashboard is there for illnesses still, but there is now a very elaborate dashboard for schools closing. So you can find that information right there. If your school has emailed you about plans to close, email that to us and we'll double check all the information, make sure it's correct, and then add it to our dashboard as well, because the schools don't always necessarily send that information to us. So share@abc15.com is the place that you can send it. Okay, so Garrett, we are seeing mitigation strategies in other states. The governor of Ohio just reported a few minutes ago that they are going to start 10 p.m. curfews as well. And so what we hear from folks all the time, well, I didn't know the curfew, or I didn't know the virus stopped transmitting at a certain hour. It's more about
I think they're trying to stop those 21 to 39-year-olds transmitting after a certain hour.
Yes, yeah. It's kind of about you might go out for a beer and you forget that you're supposed to be sitting 6 feet apart, or you're not wearing your mask just as much. So that's some of the mitigation strategies that are coming from that. But that's coming out of Ohio just a few minutes ago. Have we heard anything about that here? We have not at this point. We have not heard about a time frame to shut down. We have not heard about a statewide mask mandate, curfew for businesses to close. We have not heard about any more mitigation strategies, and as soon as we do, we'll pass that along to all of you. All right, so Garrett, the R naught number, are you still watching that as closely? I know it is at 1.09 today.
Yeah,
the error bar
a little lower today.
does dip below 1. What makes it go a little bit lower? We want to help everybody understand.
I think, believe it or not, I think we could be looking at, again, maybe Veterans Day messing with this number a little bit.
Right.
Not 100% sure. I mean, it didn't change that much. It was 1.14 yesterday, and now it's 1.09. And so they are trying to smooth out issues with reporting. But Veterans Day may be sort of having a tiny impact on this thing. But we'll see. We're really going to see in the next couple days. That's sort of the stuff that would impact this metric. Here's sort of where it is if you look at the entire thing. Now, remember, when we talk about the rate of transmission, even though we were talking about it being 1.14 yesterday, it doesn't matter anymore, because this is calculated every single day and the graph has changed every single day. So based off of where they think things are going, they change the entire transmission. So that that means essentially that while it was 1.14 yesterday, now it's 1.09 yesterday, because this is a fully sort of inclusive time series. So you have to look at it all together. That's just the way this graph works in epidemiology. So just take that in mind when you look at this thing.
And this is a great graph if you are traveling and you do need to look at how other states are looking right now. You can see that on this page as well. It's an easy to read site. Once again, it's on the bottom of your screen there. rt.live is where you can find this. And really every state, I think only one. Was there one in the green, or is everybody now in red?
Mississippi has been in the green for some time. I don't know why.
Yeah.
They've been at this 0.9 for quite some time. But when you look at sort of the other metrics out there, they're not in the 0.9. So I don't know what's going on with Mississippi, but I'm not tracking Mississippi, so I don't want to.
If there was some problem with the numbers or some
going on over there.
Yeah. Brant's joining us on here asking for Iowa, and I see Iowa smack dab in the middle of this list right now. And as we talked about last week, I know some of the ICUs are full in Sioux Falls. I know that's in South Dakota, but sometimes they're running patients to different states. So something to
1.12. Now, always when you look at these numbers, what you have to remember is these error bars are always important. What they're saying is when we go back to Arizona or even Iowa, they say we're pretty sure a 1.09 with a range of 0.86 to 1.32 means that what they're telling you is we're pretty sure this thing is growing. More often than not, when we calculate this, it's growing. However, you could be at a peak here and you're going to start going down. That's when it would be under 1. So that's sort of understand where this number comes from. They're basically, that's their estimate of what's going to happen in the next week or so.
Yeah. And Brand's saying, all the hospitals are full. We're seeing that in some of the Midwest states. We also saw the voluntary stay-at-home advisory. So it's just sort of socially suggested that people in Chicago stay at home. We're seeing those numbers pretty high in that area as well. One of the sites that I love is COVID tracking, and we can go to that and see kind of how Arizona looks, but also our data for Illinois and some of those other popular places to travel to, and why they've made the choices to implement some of these mitigation strategies right away, and also over on the Johns Hopkins site. So we can go to either of those, Garrett, to kind of give everybody a better idea.
Because it's a little easier to see all the states right next to each other and their graph lines. They do a very good job of showing what all the graph lines look like on Johns Hopkins, and that, you know, they give a color for each one, but they also sort of show. You can see a miniature graph. So you can see here's Arizona with our first peak, and then sort of the rise that we're having right now. You can see like Wisconsin, they didn't have a first peak, and this is their first surge. They're surging right now. Illinois, this is what you're talking about. Similar situation. They did not have a surge, and now they're having a surge. In fact, if you look at almost all the Midwest, it looks like essentially all the Midwest is just surge right now. All of these Midwestern states are experiencing this now. It looks like, as you can see, the Sun Belt states down here, you know, these were all states that we had an initial surge, and then it started to it's starting to re-increase. But the Midwest is really being impacted right now.
Yeah, they sure are. This site is a great place to go. It's got a couple different maps on there that give a better understanding of how things look, and you can click through to see the specific area where your friends or family are living, or other folks that you want to check on to see how their state looks. And of course, go ahead, Garrett.
Go ahead. This is a map that this is one of the first maps that was up for COVID-19 from the very beginning. We're talking from day one. This map was up for the world map. So this is one that anybody who's been tracking this should be at least somewhat familiar with this particular sort of map.
Yeah, and it's a great place to reference counties as well. So you can see we in Maricopa County, I'm saying that because it's the most populous county here in Arizona, are in the number 4 spot. If you look on the left side of your screen for confirmed cases by county, we have been as high as, I believe, 3rd. I don't think we ever got to 2nd.
No,
in all of this. And then on the right side of the screen, I'm seeing our county climb as well for deaths. We were never on this page. We're in the 6th place right now. So just something to keep in mind as you watch these numbers come in.
Yes.
So Garrett, let's talk a little bit more about the active cases. And I always like to sort of pull the curtain back and explain to everybody, there is not a place that says, okay, you're recovered. There is not a general definition on what recovery looks like. Just because you might be testing negative, you could have long-lasting effects from this. We have people who are defined as long haulers who've really been fighting this for a very long time, still suffering symptoms in all of this. And so the best way to sort of calculate that number, you have to do that yourself for our viewers, and we're grateful that you do. But you're taking 280,000 cases here in Arizona, sadly then subtracting out the 6,300 who we've lost already, and then try to figure the collection date of the positive test and sort of subtract that time away if it's been over a certain number of weeks, that you can likely say that if they are in a general category, they have gotten better from this. I hate to use the word recovered. Different for everyone.
Really, the best way of putting it is, like you said, active, inactive, because what this means is we don't know if they're recovered or not, but what we do know is it's very unlikely that they're infectious any longer. So they might be going through a recovery, yet they're no longer able to transmit the virus after a certain period of time, no matter what's going on, because they finally built up enough of the antibodies to make it so they can't be infectious. And of course, this is still an estimate, but what we have is we have about for cases, we have about 32,000 confirmed cases in Arizona that are under 14 days old. So these are basically the most infectious. We know that this is pretty much the best what we have for confirmed infections, simply because those cases are under 14 days old. Then we have another metric, which are cases under 27 days old. And while most of these could still be infectious, a portion of these would no longer be infectious. And that number is 50,855. At one point, both of these numbers were under 20,000. So that's just something to sort of consider, that where we are right now, because we're at the point where we're at 30 and 50.
It wasn't even that long ago that it was at
no, it was
20.
only like 2 or 3 weeks ago. This was, I think, the high active estimate was like 20,000 or something.
Yeah. Mavis writes, I'm glad they're explaining this. We still don't know if this vaccine will work, but I pray that we all pull through this together. Absolutely, Mavis. Thank you for your comment. That's exactly it. I mean, everybody's watching these percents come out in how likely these vaccines are to stick. And obviously they're still in the testing phase and getting ready to issue emergency orders for that to be used. And the concern in all this is how long will this last, and how can they get these vaccines out to people? How quickly, the supply chain and all of this comes into it again. We thought we learned more than we'd ever have to learn about supply chain when we had the whole toilet paper situation where people couldn't buy these things, and now we're seeing it again on the distribution side for these possible vaccines that are coming out. Okay, so as we look at this, Garrett, I want to get to some of the questions, and I know we don't have a whole lot of time left. People are asking about the flu. There is information where we can find the flu on AZDHS site as well. So I want to take you guys there so you can better understand where these numbers are. It'll be interesting to see if the numbers end up higher or lower. They could end up lower because everybody's wearing masks around each other. They could end up higher because people are going to get tested thinking they might have coronavirus, and then they continue their testing and find out that they actually have the flu, and it's one of those cases where it's reported in instead of people just getting it and recovering at home. So there are places where you can find the information on that. Compare the numbers year to year. Remember, it takes years for the full scope of flu information to come out. So you're going to be looking at information that's dated, or you can look at information that you go in and you sort of add it up yourself, but it is not stable or solidified numbers yet. It's just for your frame of reference at this point. Yep. So Garrett, thank you so much for pulling these numbers up. And I want to remind everybody, the flu season here in Arizona only started about a month ago.
Yeah, and we only have 56 confirmed cases of the flu right now. It's extremely small. And that's, again, going to have a lot to do with the fact that you said people are gathering with masks and not really gathering as much. So, of course, the flu season would just simply not be as much of a deal right now. I mean, you can see right now, when you look at our previous ILIs, let's see, this is our 21%, or this is 2021. The ILI goes to September 29th, so it's a little dated, but it's only at 0.7%. Same time last year it was at 1%, so it's lower than it was last year in the hospital surveillance. And as far as pneumonia, these are the deaths. We have, it looks like, 8 deaths. Well, let's see. I'm trying to look at this at the same time.
You know what also you're looking at is the influenza. So you're looking at the P and I number. So because this is an early chart that has not been out for more than 2 years, when it's a solidified report that comes out, they're still investigating some of those. So those are the preliminary numbers that you're seeing in there. Yeah.
So this is, as you said, preliminary numbers. We have, like, for example, the week about 3 weeks ago, 43 deaths of pneumonia. And that seems to be about, it's a little higher than it was in 2019 right now. So we'll see how this continues.
Yeah, and if you're interested in those reports that have already been put out, I think it's 2018 is the very latest that you can get, and you can find that on the page.
The full report, yes.
Yep. If you want to compare those. So just a reminder to everybody, that's where you can find that. Yeah, my view is so blurry, I can't read anything. Sorry if it's blurry, Heather.
I'm not as versed on the flu dashboard, so it just takes me a little bit of time.
Okay. Hey, Heather, that's where you can find that is if you want to look a little bit closer, it's on that AZDHS site. But when people are comparing numbers, usually like the P and I numbers, which is pneumonia and influenza, are maybe even for a bad year around 600, and then the numbers we're seeing just from the coronavirus, and we're talking deaths here, deaths from the coronavirus around 6,000. So really they're not even to be compared, but people always bring it up. So I just, for a frame of reference, I want to show you how different that situation there is. So Heather's writing, thanks. That's where you can find it. You can see it a little easier, but I want to let people know that information is out there. Okay, so Garrett, if we have all these counties going into double-digit areas, you're saying that they're reporting back their percent positivity. Do you know off the top of your head what is the highest double-digit percentage you're seeing out there? Is it as high as like 20%?
No, it's higher than that.
Wow.
Yuma County is reporting a 36% today.
36% positive test rate. So 1 in every 3 people getting tested are coming back with
the
virus.
That's actually a very good point. That there's not a lot of tests in some of these too. There's a lot of targeted testing going on in these places. It doesn't seem that there's a lot of, like, unlike Maricopa County where people are just getting tested because people like as you and I have experienced, an employer will be like, you need
You've
to go
been exposed.
Yeah. So there's people in Maricopa County that are being tested because they're being asked to by their employer or whatever. And you're not seeing that as much in the rural counties. So sometimes we get these really high percent positivities, but it's only off of like 20 tests. So that's just something to consider. It's not a great sample of the population at that very moment. That's why when we really want to look at all these counties, what's happening, we just have to look at the week by week positivity. When it gets down to it, that's really the most important one.
Yeah. Don's asking about Cottonwood. Don, let us know what information you were looking for in Cottonwood specifically, and we can show you where to find that, or teach you where you can find that each time, or look it up for you. I'm not sure. I didn't see her first comment.
It's I think we have. Let me put where we can find it. I'll put it in the chat.
Okay.
The only way to find anything on Cottonwood is at the Yavapai County Community Health Services website. It does have a number for Cottonwood. I don't have zip codes right now, Don. We're going to go over those tomorrow. Sorry.
Yeah. Actually, we'll have a Thursday.
I don't know what it is anymore. Yeah. Thursday.
Okay. And I also want to let you know some developing news that is just coming in from the governor's office. The governor is going to be holding a briefing tomorrow at 2. I don't know if he was watching this, but we really want to hear from him. We want to know what's going to happen. People have businesses that they're waiting to hear. Are they going to have greater mitigation strategies? Are they going to be forced to close? Even if that is not even in the realm of possibility, it's the question I'm getting a lot from viewers, and the big concern that's out there. So the governor just announcing that he'll be holding a briefing tomorrow at 2 p.m. All the details are going to come out later, but that's the very limited preliminary information that I can let you know that's just coming in from the governor's office. So we'll have a lot to talk about tomorrow. Let's just put it that way. And always, as I say, any executive orders that are released, I'll make sure to put them on my Facebook page after they've been formally sent out from the governor's office. So wanted to update all of you on that. Let's see. You were pulling up some Yavapai information for Don. I think, Don's writing thank you. I want to make sure she got what she needed.
Cottonwood had 24 new cases with 540 total cases. It grew faster than any other sort of metropolitan, I don't want to say metro area, but town they were tracking in Yavapai for this last update. So that's just something to consider.
Okay. Oh, good, Don. Glad you got the info, and come join us on Thursday too when we get a little more information. Sarah's writing, will you go on after his briefing? Yes. So we usually aim for about 3 o'clock in the afternoon now to keep you guys updated. If the governor goes longer than 3, which is possible because we haven't heard from him in so long, we'll just delay a little bit and come on right after with you guys. So we'll kind of break down some of those executive orders if there are any, and make sense of some of the numbers, and you all probably already know a lot of these numbers because we show them to you so often on here. Okay, so we're kind of running out of time in our afternoon here. And if there are more questions that we didn't get to, send them to us. I got a couple on Twitter, and we'll try to get them answered as best we can. Let me let you know where to find us. Garrett is on Twitter at Garrett_Archer. I had to think for a second. I saw William's nice comment down there. Thank you very much. And a sweet little red heart. So thank you, William. Very sweet. Hopefully we got you some information that helps you to make the best choices for your family and your life. And then I am on Twitter at Katie Rammel. You can find me there. And then since so many of you are watching right here on Facebook, I can be found on Facebook at News from Katie. So facebook.com News from Katie. And our other friend who spells Katie the same way as me, Katie Mae Smith, is writing, thanks, Katie and Garrett. Vicky's writing, thanks to you both. Thanks to all of you for joining us on here. Sorry we weren't here yesterday. I had to take a day off, Garrett. Have you taken a day off since the election? It's just been numbers.
No, soon.
No, you haven't. And we both each just went through the testing process, so we know what that situation is like over there. Thankfully, both testing negative, but I'm here at the station. Garrett's at home, and we're going to be back with you tomorrow. So we will have lots to talk about. Appreciate the Data Guru. Thank you so much. Cool picture too. Isn't that a
I
neat
know.
picture? Cacti here in Arizona. Kimberly writes, "You deserve a vacation."
Aw, thank you.
Can you email our boss? Just kidding. They're watching. They're
No,
watching.
he's fine.
We'll push through. We'll push through. We want to keep you guys updated. We want to keep you guys safe, most importantly. So that's why we do this each afternoon. All right, we're going to send it out from here. Be safe out there. Obviously, we'll have tons to talk about tomorrow. So we hope that you will join us. Same time, same place. Be safe, everybody.